Nearly 7 days into the indefinite strike by the Nigerian Association of Resident Doctors, the Nigerian Medical Association has declared its full support for the action, describing the federal government's failure to address the association's 19-point demand as gross negligence towards healthcare delivery in the country. Speaking at a press conference in Lagos, the NMA chairman also urged the Nigerian government to immediately reconstitute the boards of management of federal tertiary hospitals, which have remained dissolved for over 2 years. He noted that the absence of these boards has led to what he called unchecked excesses and abuses of power by some hospital chief executive. The NMA president further condemns the failure of the government and the Minister of Health to engage with NARD to resolve the doctors' concerns, which include unpaid salary arrears, poor working conditions, staff shortages, and the lack of critical medical infrastructure.
NMA Lagos State fully supports the legitimate industrial action declared by NAD following the expiration of the 30 days ultimatum given to the federal government by the association, by the NAD association. The government refusal to meet the NAD 9-point demand and the failure of the Minister of Health, Professor Pate, to engage with NAD leadership within the stipulated period is a clear act of wickedness, negligence, and lack of interest in the healthcare delivery to Nigeria.
The association also criticized the prolonged suspension of free call duty meals for doctors on active duty at the Lagos University Teaching Hospital, LUTH, a statutory welfare provision that has been withheld for more than 7 years. The NMA rejected the plan by the LUTH Chief Medical Director to provide meals to resident doctors at a subsidized rate, insisting that call duty meals are an established entitlement, not a benefit that should be commercialized.
On the issue of unacceptable situation about called duty meal in LUTH, which the CMD of LUTH till now he has not provide simple legitimate call food to doctors on call duty. It's unfortunate that the same person also went through the same process. He was given the same call food when he was doing residency program, when he was doing asthmatic. The NMA Lagos State branch, alarmed by the decision of the Chief Medical Director of LUTH, Professor Wasiu Adeyemo, to refuse the provision of free call duty meal for doctors on active hospital duty, especially those on call duty. During a courtesy visit to the office of the CMD on Friday, 11, 2025, he stated that the hospital would, instead of providing free call food, build a canteen where meals would be purchased at subsidized price, subsidized rate to the doctors. This position was strongly rejected by NMA Lagos at that meeting, and also was rejected strongly by the Congress of Lagos State NMA.
The decision of the ALD was ALD LUTH, as at our last August OGM, was that the 4 weeks ultimatum should be given to LUTH management to look into our requests. And up to now, we are yet to get any tangible response from the management. And that is the basis for convening the last emergency general meeting by NMA Lagos State. Because our members in LUTH were reaching out to leadership of NMA Lagos State to find an amicable solution to this problem. And as at the last EGM that we had in Lagos State, one of our resolutions was that a press conference like this should be held. So we are only carrying out the resolutions of the generality of Lagos State doctors. So we are using this opportunity to appeal to Professor Wasiu Adeyemo to look into our requests and swiftly, swing into action and restore the provision of called foods.
The president of the Association of Resident Doctors, Luth, confirmed that members remain fully committed to the strike. He appealed to the federal government to urgently address their demands, stressing that the prolonged action is already disrupting patient care and affecting overall hospital operations.
I did a 3 years and 2 months posting before I wrote Part 1 exam. And before this time, Part 1 exam was about 2 years posting when it was given a specialist status. Now I did 3 years, or we did 3 years, or the curriculum is now 3 years and 2 months, and you downgraded it. That's repressive, and it's only happening in Nigeria. Health workers, resident doctors in Nigeria are being repressed by the Nigerian system. We are the lowest paid in sub-Saharan Africa. I don't even want to talk about other African countries like South Africa. We are the lowest paid. And now you also downgraded our certificate. That's demoralizing. We cannot continue to work in a very repressive system. So all this needs to be corrected.
While reaffirming its firm commitment to defending the rights, welfare, and professional dignity of Nigerian doctors, the NMA Lagos State branch called on the Nigerian government, hospital management, and all relevant stakeholders to act decisively, fairly, and with integrity to resolve the ongoing crisis in the health sector. Joy Uchejem, TV 360, Lagos.